I want to tell you a story about a patient I worked with a few years back. We'll call her Jane. Jane was 81 years old when I met her. She and her daughter came to see me in the midst of a bout with colon cancer. Her oncologist had just told her that she had 3 months to live if she tried to include alternative care in her treatment plan and did not follow the doctor's exact instructions. Problem was, Jane didn't feel comfortable with her oncologist. She didn't like her or trust her, but she clearly needed medical help. My first response was that we needed to find her another oncologist. Jane's mouth almost fell to the ground. She was shocked to realize that she could choose a different doctor, one that she felt more comfortable with. Have you ever felt that you didn't have an option and couldn't change doctors? And if you tried, you had no idea how to go about searching? My name is Dr. Angela Lambert. I am a naturopathic doctor and classical 5 elements acupuncturist. Over the past 30 plus years, working with people around their health, I have heard so many stories from women and sometimes men about their frustration with their healthcare. For some, it is that the doctor doesn't have enough time to talk to them. For others, it's that the doctor doesn't listen when they do have the time. And for others, it's that the doctor tells them what the problem is without listening to their entire experience. They feel rushed to a diagnosis and then rushed to a treatment. In the world of insurance, this is unfortunately too common, and it is often out of the doctor's control. 10 minutes is the typical amount of time allotted to each appointment, and the doctor has their face buried in their computer, taking notes on the visit. Unfortunately, those are the rules. But how can you be heard if the doctor is staring at their computer screen? And how do you know they actually heard the part that you feel is important? Do you even know what part is important? It can be hard to advocate for your health, and some of us are better at it than others. So here's what I want you to understand. It is your body, and you do have a say in who you work with. It truly does matter. You have, after all, lived with this body longer than anybody else. And I want to help you find that wisdom and strength within to choose the best team for you. Let's face it, there are fantastic doctors out there. There are mediocre doctors, and there are, let's be honest, some lousy doctors. Some have excellent bedside manner. Others are brilliant, but they don't know how to connect with a patient on that personal level. And each patient wants something different from their doctor. Did you know that you actually get to have a say in whom you choose? I want to help you know how to find that person, how to know that it is the right person for you. I want to help you discover what criteria matters to you in your search. Let's go back to Jane. Once she understood that there are options, we made a plan. I advocated for her, and together we found an oncologist who had a different style and a different approach. The oncologist was supportive of Jane's desire to use alternative medicine in tandem with conventional treatments. We worked as a team. Jane was still living 3 years later and was doing amazing. She loved the oncologist we had found for her and actually had reconnected with her old high school sweetheart and fell in love. Last I heard, she was in love and enjoying living her life. I moved from the area, so we lost touch, but her story deeply touched me. I have encountered similar stories throughout the years, and I realized that some women need the encouragement, some tools and support to help them take control of their own health journeys. The word doctor in Latin means teacher. It is our job as doctors to teach our patients about their bodies, about the options. Again, it can be hard in the insurance world, but if you know how to walk into a visit prepared and focused around your concerns, it is truly possible to have a better relationship with your doctor and then a better outcome. I would like to teach you how to do that.